I discovered my mother, Freda Bush, in the process of an evolving left middle cerebral artery stroke in the kitchen of our home on Saturday morning after Thanksgiving. I knew exactly what was transpiring, so I called the EMS providers and had her to the hospital in less than an hour.
She did have a very visible drooping of the face. She had no usage of her extremities. VCU healthcare systems had the stroke center. We knew that they had the facilities available to handle it immediately, and we also knew that we had the doctors or the physicians there. They were on staff there all the time.
Dr. Warren Felton's stroke team was waiting for her and started their evaluation.
There's a phrase that we use, time is brain. The quicker that we can assess patients and begin their treatment, the better chance they have for a favorable outcome.
The stroke team was wonderful and provided excellent diagnosis and care of my mother in the emergency room.
A stroke alert is called, and that brings the interdisciplinary team of physicians to the patient's bedside. This includes neurology for a clear assessment and puts in motion the various tests that we need to complete to determine eligibility for IV TPA.
Shortly after the TPA was given, an angel in the form of neurosurgery resident Dr. Lisa Feldman came to the ER and offered angiographic thrombectomy to us as a treatment option.
I have seen patients benefit from this type of intervention, so I'm always hopeful a patient will have some kind of successful outcome, and it's that hope that just drives you forward.
Dr. Feldman had a very calm, compassionate, and reassuring bedside manner, and she was certainly a lady of action.
Her daughter had said to me that her mother would never want to live in this particular condition where she wasn't able to move her right side, wasn't able to walk, wasn't able to communicate. And she had said, please be as aggressive as possible.
My mother had complete right-sided hemiplegia and global aphasia before the thrombectomy, but post-thrombectomy has had a remarkable restoration of function. I commend Dr. Simon and Dr. Feldman for their quick action that restored my mother's quality of life.
So by getting the clot out, we were first of all able to keep her alive, and also with a little bit of rehab, able to get her walking and moving around her house and interacting with her family again.
Dr. Simon and the neurology team all agreed that without this procedure, my mother would have died from a massive left hemispheric stroke.
This procedure was key because by removing the clot from the brain, we allowed the brain that was in danger to get the blood and the oxygen it needed.
Please let the appropriate supervisors know of the great care provided by the specific individuals I have named, as they truly deserve some special recognition for their compassionate and exemplary care of my mother. Thanks again for all that VCU Medical Center does for their patients and the community.
I think we did a good job. I hear her mother has been doing very, very well, and I'm delighted to hear it.
It's a pretty thing. Yeah.